Hey guys, I'm Justin Holder with Parks Real Estate. As always, I try to bring you videos of value, and of course, we've got a big value today with so many of us looking at getting back to work, getting back to restaurants, getting back to life. But we also wonder what is the safest way to do that. So today I've got my good friend Mary Wells Smith. She is a family nurse practitioner here in Murfreesboro with a background in population health. She's been in that for 11 years. She knows what she's talking about. Hey, Mary Wells.
Hi.
Thank you for joining me today.
Thanks for hosting this. This is a great idea and really helpful to the community.
Well, you've been so good about keeping people informed and giving us real information opposed to what they're just seeing on Facebook and things like that. So let's talk about this. As the state starts to open back up, how can we do it safely?
Yeah, there's a lot of anxiety about that because people aren't sure if that means that the virus spread is over or if it's just something we're doing from an economic necessity. And it's more of an economic decision that those of us who, especially in family practice, who look at the whole of the patient and the community, we understand that you can't just ask everybody, to stop all. That would be nice in a research lab, but we realize that's not realistic. And so from an economic standpoint, we completely understand that people need to get back to work and back to some sense of normalcy, even if it's limited and new normalcy.
Yeah.
But that being said, it's not an indicator that this is over by any stretch of the means.
So do you find that
We
sometimes with people that they see that we're going back, we're going to be kind of easing back into society and into restaurants and into work? Do you see that misunderstanding with a lot of folks that they think, oh, this is over, we're all good?
I do. I think I see the misunderstanding on both ends of the spectrum, though, that people that understand sort of the epidemiologic side, the virus side, who know that it's not over. They would scream from one end like, no, we can't go back, and then the other side that for some people, sheltering in place is a privilege. Not everybody has
Yeah.
the ability to do that, and I think as a community, we have to be very sensitive to the portions of the population that's simply not an option. It's not feasible economically and financially for that to happen. And so we bought really good time with this month of sheltering in place. And that was a big part of the strategy, was partially to mitigate the spread that had to happen because of the kind of the horrific scenes we saw coming out of New York and still coming out of Massachusetts and New Jersey. I think as of a few days ago, Massachusetts was still losing about 100 people per day to COVID. So yeah, and so thankfully we've not been hit that hard in Tennessee, but the numbers were climbing rapidly, and everybody needed to pause and let for example, the Army Corps of Engineers come in and help us build out space,
Yeah.
so that when we do start to ease back into social and economic life, we've got the facilities and the supplies and the personnel that we need to be able to treat the people who have complications safely and do so in a way that that doesn't spread it to other people who are susceptible.
Yeah, so you talk about easing back in. So what's that going to look like? So many of us, I'm sitting here in my kitchen. I'm sick of eating here. I'm sitting at my dining room table. I'm sick of eating here. Yeah, again, first world problems. We're very blessed to be able to do that. But a lot of us are anxious to get back out, support the small restaurants. We want to do that, but we also want to do it prudently and safely. So what's that going to look like? I mean, what's your suggestion on how we can continue to support them if we're wanting to go there in person and not order out? I know some of them are going to have opening, but with limited occupancy and spaced out tables and things like that. Any suggestions on that?
There's been some controversy about how effective the homemade masks are, but as a general rule, most of us who understand the way the virus is spread are fans of people continuing to wear them in public. They work best when everybody wears them, actually. A lot of people are going back out with this idea that they're trying to prevent themselves from getting it, but we know that, well, we're not quite sure on the number, but it could be anywhere upwards of 50% of people who have the SARS-CoV-2 virus will have it and get over it without having had any noticeable symptoms whatsoever, which is why this is spreading so fast. You can't track it. So I've found if I tell people to think of it as though they're the ones who have it at any given point, it starts to make a lot more sense why you would want to keep your own face covered. And if everybody's doing that, then that really does help mitigate the spread of the droplet-borne virus particles.
So what about when you're in restaurants? It's not going to be that easy to eat through the mask. So
yeah,
how do you do that?
we definitely would recommend that you try to eat primarily with your family members that you've already been sheltering in place with. That would be ideal. We understand that's so you're asking an epidemiologist, perspective.
Maybe just like blended up food through a straw.
Yeah.
Only protein shakes, smoothies.
Yeah. So part of the reason that there are so many different predictions and numbers, projections coming out, is that we just don't know what people are going to do yet. This is historically unprecedented, and it's based on population density and behavior. And so in every area of the US, depending on how people treat it, we're going to have to sit back every couple of weeks and relook at that data and then offer new recommendations. But for now, I think that the current plan is reasonable to do phased reopenings. It does a couple of things. It allows some essential businesses to get back to work and stay afloat financially. And it also gives us a little bit of time to ease back in, so that those of us on the healthcare side can look at the data and do this a little more slowly, so that if we have resurges, it's easier to course correct than if
so
we
if
had
I'm
just
going
opened
out to
everything back up.
Demas's this weekend or to the alley, you tell me I can go, but only eat with my family, right? So if it's just us, we're okay.
Well, thankfully we live in a democratic republic, and I can't tell you what to do, and that's probably a good thing.
Yeah.
But ideally, we still don't know where this is at. I would personally, we're hanging back as a family, because we're getting a little stir crazy as well. But just knowing what I know, and my husband is in the healthcare industry on the distribution and supply side, and they're very tapped into the numbers as well. And knowing what we know, we're going to hang back for another month, because we can, and see how this plays out, and just see what the surges look like, what the numbers look like, and go from there.
What about when I posted this on Facebook a few days ago, we had opened it up for people to send in questions and concerns to ask you while we were on here. One of the questions that came in said, are smaller homeschool groups, co-ops, tutorials, churches, are those safe to resume meeting now or even in the fall? What about people that are, again, as much as they're missing restaurants, they're missing their church families, they're missing those things that they do with a family, small groups, that kind of thing. What's your prediction or your advice on that?
Well, there's my advice and there's my prediction. People not following it. That's usually how that goes. But my advice would be to whatever extent possible, the mask wearing. The mask wearing is hard to really get across in the US, because what we put on our bodies, this is worldwide, what we put on our bodies, and particularly what we put on our faces, is symbolic of something. And to shift that quickly to doing something that alters your physical appearance and your facade, it's been very difficult for people to figure out psychologically, I believe, what that means. What is it symbolizing if I wear a mask? And so, if we could get people to wear masks, especially as a group, in group settings. I had one friend ask me if she could resume her ballet class with her students, and one of the suggestions that I had was having a mask decorating contest, who could have the funnest mask, and trying to maintain that 6 feet or more social distancing. Again, we're doing this as a service to the people who can't. There's always going to be a certain percentage of the population that's not going to be able to do this. So for any of us who can, continue to try to maintain that social distance, wear masks in public to decrease how many respiratory droplets we're leaving on other surfaces. And the good news is the summer is coming, and people tend to be able to enjoy more outdoor activities, which just creates a natural space. We don't tend to gather as much in the summer into indoor tight spaces. So We do expect to see a little bit of natural mitigation
Mm-hmm.
in the spread just because of that. And so, optimally, if the weather's nice, we would say opt for outdoor activities and do try to maintain some distance. And if we can get the mask wearing to catch on by making contests or making them funny or however, that's really going to help slow this down enough so that it doesn't overwhelm the healthcare population or the
You think we're
healthcare
going to all
system.
have a little mask suntan this summer, like
I've
the
seen
farmer's
some
tan?
really funny memes depicting that. Yeah, that would be
So, what
fun.
about talking about memes and about Facebook and social media? I know there's been so much reckless information on
Yeah.
there. Where are you recommending that folks tune or turn to information that is accurate?
You really, really need to find your local news stations, the really boring ones that go from reporting on the president to reporting on the little lady in the neighborhood next to you who had a kid come cut her yard. Like that's actually going to be your best source because
Why is
what?
that?
Because the US is gigantic and I'm hearing all these conversations about, well, this country did this and this country did that. And what we have to remember is there are 325 million people at least in the US. Whereas we're comparing it to places like Italy that maybe has like 60 million ish. The UK only has 68 million. And so what's going to happen is as this plays out in the US, you really could imagine the United States as being about 4 or 5 different countries. And so we're going to see it spread and follow these differing patterns across the US just based on how different regions have just different cultural behaviors and different population density. And we need to be, I think, aware of that and patient with that as we see this crop up, that it really is the equivalent of watching 4 or 5 different countries. So the best thing you can do is tune into your local leaders and your local news stations. And that's why you're going to see a lot of differences in the way that state governors handle things and mayors and things like that. And I think that that's fine. Most of us that are looking at the numbers agree that this needs to be handled very much so on a local level because we're just far too big of a nation to make very many sweeping orders because we're too varied.
Yeah. Here's a question that had just come in a few minutes before we recorded this. If someone is diagnosed positive for coronavirus, how should they care for themselves at home? What items, food, medicine should they have on hand? What symptoms, indications should they keep on the lookout for that would indicate that they need to be hospitalized? And I've seen this asked over and over where folks have thought, well, I think that I've got it, but at what point do I check on it? What do you suggest to them?
Mm-hmm. Well, anybody with any kind of respiratory symptoms or fever needs to assume that they're contagious. And in the case of someone who's actually confirmed positive for COVID, if their primary care provider doesn't know, that's the first person that they need to be coordinating with. And then the CDC. So if you go to cdc.gov, the CDC has very great infographics and information about how to plan to care for someone who is positive in shared space. And everything that you asked is listed out. And I'm actually going to refer you to there because I don't want to miss something. And people think that I covered it all because they've done a much better job of that. So the CDC's website is really great for guidance on things like that. Now, in terms of complications and when do you need to seek further care, there's, anytime that you're concerned about any of your vital systems, difficulty
Mhm.
breathing, you always want to seek, emergent medical care for those sorts of things. Elevated fever, that can't be controlled, anything over 100.5 that just the symptoms can't be controlled with your normal doses of acetaminophen or ibuprofen. Things like that, you're going to want to seek a higher level of care. You want to start by reaching out to, like phone, either you can call your health department or your primary care provider to seek guidance for what the proper course of action is in the area that you live, especially again if you've already been diagnosed as positive for coronavirus. But typically we're worried about the respiratory complications. So difficulty breathing is going to be the number one thing that we're concerned about and the number one thing that would want to make a person seek a higher level of care.
Okay. Any other questions that you've heard your patients ask commonly that we haven't addressed here that we need to be especially careful of moving forward as things open up?
Let's see. I had asked for a list as well. Let me make sure I covered everybody that had asked me. Small homeschool, social media. You covered that.
Oh, let me ask you real quick. I got
Yes,
burned
sir.
up on social media because I had a photo the other day where I was at a listing with gloves on. And I guess I still don't understand. If I'm getting out of
Okay.
my truck, okay, I'm getting out of my truck, I put on the gloves right as I'm getting out. I'm in the house. Then, as I'm walking back out to my truck, pull them off, touch my door handle that's been cleaned. I get back in my car that's been cleaned. I don't understand why I was torn up over that. What am I not
Uh,
understanding about the gloves?
are these is this a new pair of gloves every time?
Yes, brand new, blue, violet, bluish violet gloves.
You know, if someone understands the way that gloving and degloving works from an infection control perspective, and they have an unlimited supply, of gloves to
Yeah.
carry around with them from place to place, okay, it can be helpful,
I
but
guess
as a
that I
general
thought
solution.
I felt like I was showing courtesy to the homeowner, showing respect that way. I guess that's the way that I thought that it seemed.
hmm I think the best thing we can all do sincerely is to be very charitable and patient with one another as we figure out, how this works and what all of this means. It sounds like the way that you were doing it might have been fine. What we have seen a lot of is people wearing gloves all of the time, thinking that that offered some level of protection. And again, that gets back to the opposite problem of they think that the only way they can get it is from something else, when
Yeah.
in
The
reality, all
cross
they're doing is
contamination
transferring
thing.
it from one, just transferring it
Do
from one
you,
surface to
is it not
another.
worth mentioning that this goofy thing is the nastiest thing that we have?
Yeah,
I mean,
yeah.
because, in our situation, I go from having, even when I have my gloves on, sometimes I'll forget, get in the car, or I'm looking at this with my gloves, take my gloves off, pick this back up. So
hmm
you want to really let people know to sanitize these?
Yeah, and as long as you're keeping it on your person, then you're usually fine. But if you're taking it out and you're setting it on someone else's surface and then taking it back, it's just as if you touched it yourself and things like that. And again, we don't want people to be um, absolutely clinical and sterile. We have to be humans, but at the same time, like you said, the things that are known, the hands and then the touching the face, the
Can I
more
get
we
it?
can.
Can I get it through this Zoom call at all? Am I safe?
I don't think
Mary
so.
Wells, thank you so much for taking the time to do this. I know you've had a crazy schedule over this. Any before we wrap up, anything else you want to mention?
No, I appreciate it, and like I said, the reason we even wanted to do this was because there's such a large communal aspect to this, that your local community really is where people need to be directing their focus,
Yeah.
and to local leaders, and finding out what's going on in your area, because that's really going to be a key part in mitigating this properly as this continues to play out.
And would you mind when we post this to every once in a while, take a look at the comments in case anybody else has any other questions?
Sure,
How
we'll
did I
try to
know
do that.
that? You've been the greatest
I
source of
try.
information for folks through this, and we appreciate it so much.
Well,
So,
thank you.
Mary Wells, thank you again so much.
Yes, sir. You have a good day and stay well.
Thank you.